Y Civil Hospital.
जिला मेघालय के त्रेलांग मनीषिम बंता यका जिंग रखे यका नेशनल वॉलंटरी ब्लड डोनेशन डे आर्जर अफुवई यका नेक प्रोग्राम अपनिया दका मेघालय एड्स कंट्रोल सोसाइटी हकबला पल्लाव हदन बस्को सेंटर मंता कशितरेक दिसाव आर्जर अफुवई हकबा की बोन की समला किला वांच खमात क्लेम कनरंडियन बनो सिंजang nakaman sobha banaisna Usampat Kumar IAS Principal Secretary Health and Family Welfare Ubade Kongsan Balayadan Bantalangru Dau Dr. M. Maure State Tuberculosis Officer Dr. Mrs. Alia Project Director Mikhalia AIDS Control Society Shillong Bat Kiwekiwen Nakajua Kapua La Pynlong Kajing Sam Kusnam Yakitio Kibajuna Sinyang Sna
This dreaded two diseases. As you are aware that tuberculosis is caused by a bacteria called Mycobacterium tuberculosis. It has been identified by a French scientist, Robert Koch, in 1882. Our country, India, accounts for 1/4 of the global TB burden. And out of 1 crore new cases annually, India contributes 27 lakhs cases, and every 2 minutes, 1 TB patient dies in the world. So as you are aware that 40% of the population are infected with tuberculosis. And the lifetime risk of breaking down to disease among these infected people is 10 to 15%. This is so because the breaking down to disease among the infected ones will depend on the immunity system of the body and the resistance of the individual. In India, 50 to 60% of AIDS cases reported have TB at any time in their lifetime. We know that TB is one of the leading causes of death in people living with HIV.
Blood donation day. So when we do this, essentially, we get to remind ourselves, especially the importance of the health of the people, importance of various services for providing positive health to the people. So these are the occasions where actually we all come together, reflect how we are doing, are we doing better, where we need to improve, where we need to appreciate those actually good work is happening. So these are the occasions which are very, very important. And I must say that though we have a lot of challenges in the state, but we are progressing very well. In fact, we are able to collect over 14,000 units of blood in the state. So that's quite a very positive step, because we have seen the blood donors who have come today, and it's really remarkable. And we call them positive deviances. Positive deviance means where in a place where you're not finding many donors, but you're finding some of them are coming and they are inspiring others. So it's a very, very positive step. I think we should understand, learn from the positive deviant stories, and we should really propagate. Today, in a state, in a given state, we have around, currently maybe our population will be around 3.8 million population. So for every, that means 38 lakh population will be there. For every, basically for 1 lakh, or you can look at 1%, 1% of the population might require blood transfusion services. That means we require around 38,000 units. So whereas, so that's a kind of a challenge that what we have. So today's program is aimed at encouraging that voluntary blood donation, and also strengthening the blood transfusion services and the systems across the state. So here actually a very good presentation is given by Dr. Gupta, and I I'd also like to tell you that like we have a very good team. Dr. We have a Director of Health Services, Dr. Linda is here, and Dr. Alia, and all of you, in fact, from various districts, those who have come. I think we are all trying to actually bring that services closer to the people. So coming to the another important thing the state government has brought out this year, and we have taken this COVID period to learn a lot of things, understand what are the health challenges, what are the health basically the issues that where we need to focus upon. So based on that iterative process, constantly that what we have done from the last more than 1.5 years. So we have brought a state health policy. In fact, the state government has brought a state health policy. The state health policy is actually essentially aimed at promoting positive healthcare. Positive healthcare means it's like most of the time health means what people do. They look at when the problem comes. That means what does it mean? So if somebody has a problem, then only actually they come for the healthcare. But we have to understand that there is another important dimension is the prevention. There are a lot of things that what we should do before actually one seeks a curative healthcare. So the state has brought this positive healthcare model where we are going to focus on preventive along with curative and also enabling. So preventive, curative and enabling. These are the three dimensions through which we are going to work, and we are working actually. And this is giving some good results also. The way actually this is one of the examples that what we have actually celebrated today. How actually we are trying to improve the blood transfusion services, because one of the reasons why the blood transfusion is required is that because when I'll give an example. Out of the pregnant women what we have in Meghalaya, as per the NFHS data, 53% are anemic. What does it mean? Pregnant women, anemic is not, basically, then if they are severe anemic, you require blood transfusion services. You require, and if there is a retained placenta during the delivery, if there is a postpartum hemorrhage where, so in such cases, you definitely require, blood transfusion. So this is where, we require a lot of awareness about it, that, how actually we can prevent that, before coming to that stage. Can we prevent the anemia? Can we reduce the anemia before actually, they come for the delivery? So these are the things that we have been working now, like putting a lot of focus on that preventive aspects. At the same time, when there is a need, we should be able to have the services. So that's another very important thing. And I'm sure, with this kind of an effort, with all our collective efforts, with both with the government and basically giving a song, presenting a song that is inspiring everybody. So the idea is that how actually we can increase, the quality of life. The quality of life needs to be increased. In fact, there is a concept called life expectancy. The life expectancy is it requires it depends on the quality of the life that one actually have. So we really require to improve that one. We really require to increase that life expectancy, productive life expectancy. So that's the aim of the state that actually through state health policy is trying to promote. So at least can we add another 10 years of productive life expectancy. That's something that a goal with which we are working collectively. Every week actually all the districts and the deputy commissioners and the district medical and health officers and all the health officials and other social welfare officials, because they have to deal with the nutrition aspects. Community and rural development officials, they have to deal with the issues of poverty. Somebody said, like our Dr. Maureen from TV, unless we really require to address all the socio-economic determinants of health, so that we'll be able to improve that quality life and also life expectancy of the people of the state. So with this few words, actually I would like to again appreciate all of you and also thank all of you for presenting and in this very important campaign. Thank you.